Healthcare is one of the top social and economic problems facing Americans today. The rising cost of medical care and health insurance is impacting the livelihood of many Americans in one way or another. The inability to pay for necessary medical care is no longer a problem affecting only the uninsured, but is increasingly becoming a problem for those with health insurance as well.
What is the issue with health insurance?
I think health insurance, the way that they're trying to do it now is that they're trying to give everybody an equal opportunity, but the problem is that the program that they're trying to do, the way they're trying to execute is very poor. But I do think that everybody should be allowed to have health insurance in the country because if they need it, they shouldn't have to pay for it because some people might not be able to afford it.
I think you understand how the new Affordable Care Act works.
I think that it works the way like everybody's supposed to get health insurance and they're supposed to be put on a plan, but that's all I really know. But everybody's supposed to be able to get health insurance at a reasonable price according to their income.
Do you think the new Affordable Care Act will be good for the economy?
I think the Affordable Care Act would actually be a pretty good plan for the economy. I just think that it's been executed very poorly with the crashing of the website and a lot of people not being able to apply for it online.
Do you trust the president after what happened with the Affordable Care attack?
I think the president is kind of, I don't know. Right now, I wouldn't trust him I trust him a little bit, but not that much just because he executed the plan very poorly. But I believe my trust is still him just because I think he means well and he's going in the right direction.
What are the good things you would find about the Affordable Care Act?
Affordable Care Act, I think, is gives health insurance to everybody and ensures that everybody will have a plan. And it also lets it adjust to how adjust to everybody's needs. So if you're a low-income family, then you wouldn't have to pay as much. If you're a higher-income family, you might have to pay a little more just because you have more money.
Do you think the Affordable Care Act is good for children?
The Affordable Care Act, I wouldn't say probably children get the great end of the deal because a lot of it depends on the people and their employers. So depending on what their employer chooses and depending what plan they get, kids could have more than enough money than they need, or they might not have enough money. So I think that they should write something, maybe a different section in the law saying that kids would get certain benefits from it because honestly the kids would probably be more important than the parents would be.
The Affordable Care Act is good for immigrants.
The Affordable Care Act, I don't think how benefits immigrants just because in this country we have a lot of illegal immigrants, and so if they come and try to step forward and ask for it, they wouldn't get it because they aren't legal, and so we'd probably end up deporting them before they even get a chance to get in. For legal immigrants, I think it's good because they'd be treated just as other citizens, and depending on their income, again, that's the plan that they would get set to for years to come.
Do you think the Affordable Care Act is good for insurance industries?
Well, the Affordable Care Act I don't think is very good for the insurance industries because there are a lot of private insurance companies that really want to be able to still sell their insurance to people who want to buy it privately, but because Obama came out and started the ACA, he wants to give everybody insurance so they don't have to pay for it, so this is hurting their business and you might see a lot of companies go under potentially.
What's the issue with health insurance?
Well, I think in the United States today, health insurance is one of those absolutely essential pieces as far as how you survive economically in this society. I mean, take for example, I think it was back in 2007 that the leading cause of bankruptcy in the United States was healthcare bills. That people could go into a situation, or a family member or loved one would, and they would suddenly have $40,000, $50,000, $100,000 in hospital debt from life-threatening illness or a compilation of those things. And so you're stuck in that regard. If you don't have health insurance, you're the one that's footing that bill. And that's not debt that's easy to finance. It's usually something that is crippling for American families as far as their economic stability. So I think that's the issue. I mean, as far as the insurance piece, there are others that attach to it, but in my mind, this is a question of do we as a society value people's right to access to that or not? And I think up until the last couple of years, the answer has been basically not, beyond a select few.
Oh, do you think you understand how the new Affordable Care Act works?
In the general outlines, yes. I'm not one who's been purchasing health care from one of the exchanges. I'm in a spot where I meet the federal law's requirements about health care insurance through my employer, the Bellevue School District. So I don't have the firsthand knowledge. I might refer you to somebody else on that. But as far as the broad outlines of it, the idea is that you're mandating that people buy insurance, or that they have insurance, right? Either through their employer or through these healthcare exchanges. The idea is once you have that all set, that there are only a very few that don't have access to it, you'll lower the cost of healthcare through having more customers for the industry, which we'll see if that works. In theory, it should. You're also in a spot where the poorest amongst us, whose healthcare plan is basically called 911 when it gets really bad, I mean, that is enormously expensive for cost. And if you're waiting to that point and choosing that most expensive bailout option for your health care, then you're talking about high prices that are going to be met across the board. Alternatively, if you have a system that's there that provides for wellness checks and a more stable form of health care that's more preventative, the idea is you'll have fewer of those disaster incidents for families to kind of try to bail themselves out by an ambulance ride. So that's the idea of it in terms of it. Does it cover everybody? No. Does it reduce the amount of those that are uninsured? Yes. Is it perfect? Far from it.
Do you think the new Affordable Care Act will be good for the economy?
I think the Affordable Care Act can be good for the economy, and there's a lot of ways to look at that, because when we talk about the economy, you're talking about a $15 trillion American economy. So there's a lot of room to decide who it's good for and who it isn't. In terms of the elite, in terms of the healthcare industry and those sorts of things, they're basically getting the government to shoo in more customers to them. So I see this as a net gain for them. As far as the bureaucracy of having to deal with more government layers and those sorts of things, I think a lot of that's overblown, but that's my narrow perspective. I could well be wrong with that easily. I don't work in a hospital, so I don't know how that is. I think that in terms of the poorest in this country, it provides a thin but at least somewhat present security net for that, and it hopefully will drop the price of health insurance for middle populations in terms of their costs out of pocket. Hopefully, we'll see.
Do you trust the president after what happened with the Affordable Care Act?
You're probably specifically referring to the website fiasco as far as the rollout? Sure. And I think that as far as that sort of thing, it's clearly a black eye on the White House, that they were looking at that, and it's a bruising reality that when they got ready to roll it out, it fumbled badly. But in terms of, do I trust the president after the rollout of the ACA? Did they work to improve it? Yes. Is it going better now than it was 5 months ago? Yes. Trust is something that's earned. I think that in this narrow area, is the president attempting to do something that's going to help more Americans than what we previously had? There's no doubt that that's the case. Is it something that's perfect? Does it meet my ideals of what the healthcare industry should look like? No, it doesn't. But I'm one of those, union fringe wacko guys, I guess, that says we should have single-payer health care. It should be on the government's dime. It should be a human right. But that's not a popular position.
What are good things you would find about the Affordable Care Act?
IBID. See my previous remarks. Next question.
Do you think the Affordable Care Act is good for children?
Yes, but it has limits. I think if you're taking a family that doesn't have insurance under the old system, and mom or dad gets sick or child gets sick, and there's simply no money to pay those hospital bills, then you're talking about a toxic set of circumstances there that can be corrosive to the bond of the family. Just the challenge of making ends meet. What's mom and dad going to do then? If their kid is sick, what they'll do if they don't have insurance and if they don't have access to it is they're going to take more jobs, which means less time with the kid, less time with the other kids. And that's the sort of thing where you're fighting to save somebody's health in terms of their life, but the quality of life for them or their siblings is being reduced. So we as a society should commit ourselves to the idea, on my soapbox here for a moment, that we can do better. That we can do better. There's no reason why America in the 21st century, wealthiest nation in the world, that spends $1 trillion on defense every year, at least half of which is unnecessary, that we can't redirect our priorities and say that we need to make a stand in favor of children in terms of their health, their families, all those sorts of things, and it doesn't matter what color, what their religion, or what their income particularly is in terms of our society.
Do you think the Affordable Care Act is good for the insurance industry?
I think I already addressed that one, but yes, ultimately I think that it is. I think it provides more customers for them in the long run. I'm going to end it there.
What's going on with health insurance right now?
Well, quite a bit. There's a lot of things or a lot of unknowns right now that people don't understand. We don't know what it's going to cost. Insurance companies don't seem to be engaging as well as they had hoped, and not enough people are signing up. The website didn't work for a while, but that seems to be working better now. So the issues are, I think a lot of people are just really nervous about what's going to happen with healthcare.
Do you think you understand how the new Affordable Care Act works?
Yes, I think I do. I've looked at it, done a little bit of research, I got healthcare. I didn't use the exchange, but I do think I know how it works.
Do you think the new Affordable Care Act will be good for the economy?
I don't think so. I think that when they find out what the real cost is and how it won't really make economic sense, that it'll end up being just a larger tax on all of us.
Do you trust the president after what happened with the Affordable Care Act?
No, I really never did.
What are the good things you would find about the Affordable Care Act?
Well, I think because it's going to cost so much, people are probably going to try to get a little bit healthier, because if they start sharing in the cost with these high deductibles, they're going to have to figure out a way to get healthier. So it might end up with a healthier group of people.
Do you think the Affordable Care Act is good for the children?
There were some things where they let kids stay on plans until they're 26 years old, and it will supply access to health care to poor children. So yeah, there's some good things there. I just don't know if it is going to cause such a cost in the long run to where these young kids now will be paying for it for the rest of their lives.
Do you think Affordable Care Act is good for immigrants?
Well, if you're undocumented, you don't have access to the Affordable Care Act, so I could think of about 13 million people that it's not so good for.
Do you think the Affordable Care Act is good for the insurance industry?
I would imagine if a lot of people joined and they were able to get the cost down and there was enough balance between young and old people, is that it could be probably a profitable market. But everything that I'm reading right now is there isn't really many insurance companies that supported the Affordable Care Act and currently aren't real happy with how it's gone so far.
2012, nearly half of adults ages 19 to 64, or an estimated 85 million people, did not have health insurance for the full year, or were uninsured and unprotected from high out-of-pocket costs. The amount people pay for health insurance increased 30% from 2001 to 2005, while income for the same period of time only increased 3%.
The underinsured are those who have health insurance but still struggle to pay their healthcare bills. Many of them are faced with rising healthcare premiums, deductibles, and co-payments, as well as limits on coverage for various services and other limits and excluded services that can increase out-of-pocket expenses.
Problems with healthcare are affecting many Americans, the uninsured and insured, the unemployed and working, children and retirees, single individuals and families. From lack of access to preventative care and high cost of medical treatment, there are many health care problems facing Americans. By sharing our expenses and problems in regards to health care issues, hopefully we can find a better solution for fixing our healthcare system.